All right, good afternoon and welcome. Thank you for coming to the Planning for Medicare presentation by Blue Cross Blue Shield. I'd like to thank Heather Hurd for speaking to us today and answering all of our questions on Medicare. Thank you to those joining us live in person at the Robb Center, and thank you for those joining on Zoom. We are recording this presentation, so if you need to remind yourself of anything and you want the recorded presentation, just let me know and I can send it over to you. Those on Zoom, if you have questions, feel free to utilize that chat function. Louisa from Blue Cross Blue Shield will be managing those. Those in person, if you have a question, raise your hand or write something down, pass it up to me, and we'll make sure all of the questions get answered. And with that, I'm going to pass it off to Heather Hurd to start the presentation.
Thank you so much, Kelly, for the opportunity to offer this program to the Robb Center, and hello to everyone in Andover, Massachusetts. I'm Heather Hurd from Blue Cross and Blue Shield, and with me is my coworker, Louisa Lewis. And as Kelly said, Louisa will be handling your questions. You can type those in the chat. If anybody would prefer to ask a question out loud, we will stop at a few points during the presentation and say, are there any questions? You can take yourself off mute, ask a question, and we'll respond. We won't say anyone's name. And then please keep yourself on mute when you're not asking a question. Just for the recording and the presentation, we don't want any background noise. So this program should take about 45 minutes. This is an educational program from the senior outreach team where Louisa and I work at Blue Cross Blue Shield. We're not talking about our own plans and products that we offer, and Blue Cross does offer all kinds of Medicare plans. But this is an educational program to share with you what it means when you get ready to go on to Medicare, excuse me, what Medicare covers in 2022, how much Medicare costs, how do you sign up, what's the timing for that, and then we go over all of those various types of Medicare plans that people buy when they're on Medicare. So they work differently, there are different premiums, we'll give you approximate costs. So we have two sections to go through. Section 1 is where we'll spend most of our time. This is about Medicare and Medicare related options. So Medicare and those various plans, we'll explain them to you. We do have a short section at the end. It's only a couple of slides, but it's for people who are planning to retire and let go of employer coverage before they have reached Medicare eligibility. Oftentimes people ask us, what can I do to continue with health coverage before I become eligible for Medicare? So we'll go over that. But we'll spend most of our time here on section 1, which is about Medicare and Medicare related options. So we're starting here with a slide that has a lot of boxes, but we're trying to show you that at some point, most people go on to Medicare, and original Medicare is federal coverage. I'm going to do a review on that over the next couple of slides. Once you have original Medicare from the government, that's made of parts A and B. That's the federal coverage, and some people will stop there and they'll be on Medicare, but most people do not stop there with that national coverage. They look to buying other Medicare plans. And you might ask, well, why do people need to buy other plans? Isn't Medicare enough coverage? Medicare is providing core benefits, but it's not 100% coverage, and it doesn't pay for some preventive services that we're used to having. And also it doesn't pay for prescriptions, and it leaves you with out-of-pocket costs, usually some deductibles and 20% balances called coinsurance. So if you don't want to be exposed to that kind of cost sharing, you want coverage for prescriptions and preventive services, then you look to buying other Medicare plans. There's two ways of buying other Medicare plans that we see here in our market in Massachusetts. One way is to add something called a Medicare Supplement onto Medicare. This is secondary coverage. People who buy supplements usually then buy a Part D prescription drug plan to pay for their medicines. So people who have Medicare, a supplement, and a Part D plan have 3 insurance cards in their wallet. You might know people who do this. They carry around the 3 cards. They have their medical coverage between Medicare and a supplement. They're just showing that drug card at the pharmacy. Other people might opt for another arrangement. They'll buy something known as a Medicare Advantage plan. These are usually HMO and PPO type of plans. Sometimes these are called optional replacement plans to Medicare. And the reason for that is when you sign up for a Medicare Advantage plan, it does take over and become your primary coverage. That means you're only showing that one insurance card wherever you go. You're getting your medical benefits, extra benefits, and usually drug coverage all on the one card. Now, with an Advantage plan, even though it becomes primary coverage, you never lose Medicare. You have to continue to pay. Medicare Part B has a premium. So today, what you see people do are the 3 cards, the 3 separate plans, or the Medicare Advantage plan. And every year, you're allowed to change your options. So let me do a quick review now of Original Medicare. This is health insurance provided by the federal government. There are 2 parts to Original Medicare, Part A and B. Medicare was enacted in 1965, so it's been around a long time now. Part A is paying for inpatient coverage, so you can think of hospital room and board, skilled nursing care. Part A is free for most people. Medicare Part B pays for all the services we have with doctors and outpatient services. You can think of labs, specialist visits, physical therapy, all those outpatient services are covered by Part B. Part B is not free. Everyone on Medicare pays a monthly Part B premium to Uncle Sam, to the federal government for Medicare Part B. And the standard premium in 2022 is $170.10 per person per month. So that's an individual premium. Higher annual income will increase the cost of Medicare Part B for some people. So I do have a slide to show you coming up on who might be impacted by that. There's a picture of a Medicare card, just a sample. And when you have Medicare, you can see any provider around the country that participates in Medicare. You don't need referrals, it's not managed care, but you do pay out-of-pocket costs in the form of, there are a couple of deductibles you have to consider, and then 20% balances usually. When and how to sign up for Medicare, this is the question we get asked most by people. When am I eligible, and how do I go about enrolling? So people are eligible for Medicare because they've turned 65. That's one eligibility criteria. Another one is some people might be younger, but they've been covered for disability after 2 months of a disability. They may be younger than 65, but I'm sorry, after 2 years of disability. So on the 25th month. So after 2 years of disability, you might be eligible for Medicare. Now, I'm going to go through a few scenarios that are the most common scenarios for becoming eligible and enrolling onto Medicare. Most people fall into these 3 categories. If you do not, if your circumstance is different, we would encourage you to contact Social Security, because that's the agency that is determining your eligibility for Medicare. So you're going to work with Social Security to sign up on Medicare. Here's the first common scenario. You're turning 65 and you are collecting Social Security benefits already. Well, in this case, you should automatically receive your Medicare card 3 months prior to your birthday month. Everything with Medicare starts on the 1st. Coverage starts on the 1st of the month of your 65th birthday, unless you happen to be born on the 1st. So let's say someone is born today, August 2nd. Their Medicare was effective yesterday, August 1st. But they could be born August 30th. Their Medicare would be effective August 1st. But if they happen to have been born on August 1st Then their Medicare was effective on July 1st. Here's the next scenario. You're turning 65 and you're not collecting Social Security, but you want your Medicare coverage to begin. Well, that card is not going to automatically come in the mail. You're going to have to contact Social Security and let them know it's your birthday and you want to sign up. You can do that as early as 3 months prior to your birthday month. So you can contact Social Security, you can call them, you can go on their website. Many offices are now opening up for appointment. You can go down 3 months before your birthday month and sign up for Medicare. This 3 months prior to your birthday month is actually the beginning of a very official time frame, an enrollment period with Medicare called the initial enrollment period. It's 3 months prior to your birthday month. It lasts for 3 months after your birthday month. We see people continuing to work more and more later after becoming Medicare eligible. Some people just like what they're doing and they keep working. If you continue to work past age 65 and you work for a company that has 20 employees or more, you have a choice then. You can keep that employer plan as long as you're working and carrying those benefits. And that would include your spouse if you're covering a spouse who's Medicare eligible. You can delay signing up for Medicare Part B with no penalty as long as you have that group insurance and that company has 20 employees or more. Now, if you work for a smaller company, fewer employees, or you're self-employed, I think you need to go onto Medicare. I would contact Social Security. You'll need to take Medicare, and the other coverage would be secondary. But if you have that larger company, your employer plan's primary. Some people sign up for Part A, even though they have employer coverage. It's not required, but you can, and Part A is free. But later on, when you plan to stop working, go back to Social Security, give them a couple of months notice, and let them know you want Medicare Part B to begin on the day that you're planning to, when you're retiring and you're letting go of that group coverage. Social Security will send you a new Medicare card with A and B. They'll start now collecting Part B's premium, can come out of a Social Security check or they'll bill you. And they'll ask you to have a form signed by your employer showing that you've had coverage all the years past 65 when you were eligible for Medicare and you didn't have Part B. That form, it's called something like proof of employer plan. They'll give it to you or tell you how to find it. That is what prevents you from having a Part B late enrollment penalty. There's only one situation where people don't want to sign up for any part of Medicare, A or B, and that is if they have at work a plan that's paired with what's called a health savings account. If they are funding an HSA, they should not have any other insurance apart from that employer plan, and that includes Medicare. And these are IRS rules. You have to stop funding the HSA 6 months before going on to Medicare. Now, if you have some other type of plan, flexible spending account, health reimbursement arrangement, employers offer various things to their employees. FSAs and HRAs do not impact Medicare at all. So I don't see any questions in the chat. I'm going to do 2 more slides and then I'm going to check in with Louisa. So the next 2 slides are going over the out-of-pocket cost sharing of Medicare in 2022. So if people go on to Medicare this year and they don't buy any other coverage, they don't buy any other plan, they just have Medicare, that's fine. They have the national health insurance through Medicare, but they have out-of-pocket costs that they're going to be responsible for if they have, when they go for services. So this slide is covering Part A, that's inpatient services. If someone goes into a hospital this year and their length of stay is between 1 and 60 days, Medicare is going to cover them for that hospitalization, but they have a Part A deductible of $1,556 to pay. and then Medicare pays the rest. This runs on what Medicare calls a benefit period. So this deductible and these cost sharing amounts are not per admission. They're not per calendar year. They're per benefit period. A benefit period begins the day you go into a hospital or skilled nursing facility. It ends when you have been home for 60 consecutive days or more. So to give an example, let's say someone were to have a hip surgery, they were in the hospital 5 days, they paid the $1,556 deductible to the hospital, and let's say they went home more than 60 consecutive days. Maybe they were home several months, half a year, and then they were readmitted to the hospital. That second admission, because they were home 60 days or more since the first admission, that second admission is in a new benefit period, they pay another deductible. Now, if they were home less than 60 days, maybe they were home 2 weeks and they were readmitted to the hospital, then they will not pay that deductible again because according to Medicare, they're in the same benefit period. Catastrophic circumstances, if someone is in the hospital for a long stay from day 61 to 90, Medicare asks for a daily contribution from the member, $389 per day. From day 91 to 150, that increases to $778 per day. Those last days, 91 to 150, people only get them once in their lifetime when they're on Medicare. If someone goes from an inpatient stay to a skilled nursing facility, maybe they're not ready to go home, but they don't need to be in the hospital anymore. As long as they've had a 3-day inpatient stay prior to going to skilled nursing, that skilled nursing is covered by Medicare 100% for the first 20 days. From day 21 to 100, Medicare is still covering skilled nursing, but the member is contributing $194.50 per day. And skilled nursing is capped at 100 days in a benefit period. Let's look at Part B. These are services we have probably more often than inpatient stays. We go to the doctor. We have physical therapy. We see specialists. We might have some lab services, x-rays. Durable medical equipment is covered by Part B. So if I needed some crutches or a wheelchair, that would be Part B covering me. Diabetic supplies. There are certain preventive services that are paid in full. Examples being annual mammograms, annual PSA screenings, yearly wellness visits. These you don't have to share in the cost, but everything else with Medicare, the way it works is Medicare is really covering 80%. You're paying 20%. There is a one-time calendar year deductible in the beginning of the year that you have to meet. In 2022, that's $233. And then for the rest of the year, you're paying 20% of the balance towards these services. Medicare is paying 80%. Medicare's payment of 80%, though, to Medicare providers is based on a fee schedule. So 80% is not of whatever the doctor charged, it's of the Medicare negotiated rate. Your balance of 20%, you're getting the benefit of that Medicare negotiated rate. So it's discounted price. So these bills will come from your providers, the deductible and the 20%. There are some services, original Medicare doesn't cover. Prescriptions, you need Part D, we'll talk about that. And some routine services, vision, hearing, dental, and Medicare also doesn't cover you outside of the US. So I'm going to stop there and see if Louisa would like to add in any points or if we've had any questions in the chat, or let me check in with Louisa first and then I'll see if the audience has any questions. Please stay on the Medicare section. We're going to move into supplements next. Hi, Louisa.
Thank you, Heather. And welcome to the audience. So great to have you with us this afternoon. We hope you're finding this presentation very helpful. So we just finished really talking about original Medicare. So now we know that become somewhat familiar to what costs are expected of you if you stay in original Medicare. But now we're going to explore also other options that you may be able to add or consider adding, so you're not paying a lot of money out of pocket. Once you get into the Medicare type benefits, one important thing that you've probably seen, or if not, you're going to be having what it's called individual coverage. So back when you had employer coverage, you had the opportunity to have a family plan or double coverage. That is no longer the case once you switch to original Medicare. So it's important that you consider that, because that definitely probably helps you decide which direction you're going to go with. And any questions that you may have, you can write them through the chat, or if there are questions that you like to say out loud, let us know. We'll be happy to answer them for you as well.
Thank you, Luisa. Does anybody in the audience have a question about original Medicare or signing up? Okay, I think we're going to move on now to to the types of plans that you can buy. And we're going to start here with Medicare Supplements. These are also known as Medigap plans. So these are very popular, and supplements have been around quite a few years. So when people see those out-of-pocket costs of Medicare, sometimes they decide they want another plan to pick up those balances, to specifically pay the gaps of Medicare or what Medicare leaves behind. So a supplement, a Medigap plan, it's the same thing. You buy it from a private insurance company. Supplements are handled on the state level. They're not federally regulated. So every state, has their supplements offered by a handful of insurance carriers. In Massachusetts and in 2 other states, we have our own unique supplements. I'm going to go over what we have here in Massachusetts. The rest of the country has 10 standardized plans, and I'll show you those because sometimes people are, on these webinars and presentations from another state, or you're planning to move somewhere else, and you might want to know what's available. Regardless of where you get your supplement, it works the same way. Medicare is primary coverage, supplement is secondary coverage. Medicare pays first, supplement pays second. You show 2 insurance cards wherever you go. You have no co-payments, no referrals, and you maintain nationwide coverage with Medicare providers. So here's what we have in Massachusetts. On the left of the chart are the balances that we just reviewed of Medicare. And now you see a column for the 3 types of supplements sold in our state of Massachusetts. They are called Supplement Core, Supplement 1A, and Supplement 1. Now, Supplement 1 plans, these plans are the most comprehensive. They pick up every balance after Medicare A and B. They average about $220 per person per month. Remember, you have Medicare A and B, so you're still paying Part B, that $170.10 to Medicare. Now you're paying a premium to a private carrier for your supplement, so you have to add those 2 things together. Supplement 1 plans, between Medicare and Supplement 1, you have no out-of-pocket cost for Medicare covered services. Now, a federal law was passed in 2015 known as MACRA, and that law limited enrollment into supplements that cover 100% after Medicare, which includes our Supplement 1s in Massachusetts. So not everybody can sign up for Supplement 1 now. You had to have been eligible for Medicare A and B prior to January 1 of 2020. So if you turned 65 a couple of years ago, you may be eligible for Supplement 1. But if you're just turning 65 this year, next year, or you did after January 1 of 2020, because of that law, you are not eligible for a Supplement 1. The good news is you're eligible for a Supplement 1A. And 1A is almost the same as Supplement 1. There are two differences. Supplement 1A is less expensive. It's about $200, even $190 in some cases, per person per month, so lower premium. And it doesn't pay for one benefit after Medicare. You can see right in the middle of the chart, there's no green check mark next to that Part B deductible. So Supplement 1, you'll pay less premium. I'm sorry, Supplement 1A, you'll pay less premium than the one, but you are going to have to get you will get a bill in the beginning of the year for that deductible, that Part B, the first $233. And then after that, Supplement 1A pays everything after Medicare, no copayments. Supplement core plans are the least expensive. They're about $110 per person per month. You can see by way of the chart next to the hospital deductible, there's no check mark. So if you have a core plan and you go into the hospital for an inpatient stay, you are going to be responsible for that deductible, where the other two plans you're not. The core picks up the costs for a long hospital stay. In fact, all three plans do. So if you're in the hospital beyond day 60 up to day 150, the core does not pay the skilled nursing. If you're in a skilled nursing facility from day 21 to 100, core doesn't pay those costs, whereas the Supplement 1A and those plans pay the coinsurance. The core also doesn't pay the Part B deductible. Just like I said, the Supplement 1A did not. After that deductible has been met for your doctor care and outpatient care, Supplement Core, all three of these plans are picking up the 20% balances after Medicare. So you never have copayments with supplements. None of these plans cover your outpatient prescriptions. Those are the prescriptions you pick up at the pharmacy. You know, your doctor gives you a prescription, you have to go down and fill it. None of these plans cover that because these plans are only supplementing original Medicare, and original Medicare doesn't cover prescriptions. We're going to talk next about Part D. That's what covers your medications. Medicare doesn't cover you out of the country, but our state's Supplement 1A and Supplement 1 plans do provide worldwide coverage. There is a core plan in the market that does as well. It's just not checked off there because it's not a mandated benefit. When you're out of the country, usually the billing's not happening directly. The providers are asking you to pay and bring your paperwork back home for reimbursement. So one thing that's really nice about supplements in our state of Massachusetts is you can change them monthly. We have something called continuous enrollment. So you can sign up, for example, on a core plan, and you can move to a Supplement 1A for the first of the next month. You can go from 1A back to core. The only limitation on switching is if you're eligible for a Supplement 1 and you want to go to the 1A, then you have to wait a year, but you can go to core anytime. So these are our three supplements in our state. I've given you average premiums because there's a number of carriers selling them and we're all selling our own plans. If you're planning to move to another state or you're just curious to know what is there around the country, we have supplements that are identified by letters A through N around the country. These are the standardized national plans. They may follow different enrollment rules. There may be enrollment periods. And if you miss that, you have to wait for the next one. You just can't get on a plan anytime you want. There may be out-of-pocket limits, underwriting guidelines. Every state has their own rules. So you really need to check state by state. And not all plans cover exactly the same thing. So you can see in the case of Plan K and L, those plans don't pay 100% after Medicare. I'm going to stop there and see if Louisa wants to add anything, and then we'll move into Part D. Hi, Louisa.
Hi. So one of the things that we always get asked, help us understand a little bit more beyond of the benefits, things about supplement. So we always share the one thing that Heather just covered is the fact that they have what it's called continuous enrollment, that you can make changes to the plan design, upgrade or downgrade. But also another great feature is the fact that they're portable. So if you enroll in a supplement plan while you are a resident of Massachusetts, you can actually take that plan with you. You're planning to move to another state, like let's say California or Florida. That plan will cover you there. You may want to check what's available on those states, but if you were very happy with your coverage, you can actually continue to use your plan. And another thing that makes them attractive, there is a predictability factor. And what I mean is that beyond the premiums, you're able to really know what's going to be covered and what may be your out of pocket, again, depending on the plan design. But so with that, you're going to pay the amounts upfront, and that means by covering the premiums. Heather did explain that you do still need to cover your Medicare Part B premium. So with that, that is not going to change whether you went on a supplement core or on a supplement one. If you were eligible, you continue to pay those premiums. So you're paying two premiums after looking at the Medigap options. And Heather, there is a question about the availability of slides.
I'll send a copy of the slides to Kelly McKay and she can feel free to share them.
Perfect. And with that, back to you, Heather. Thank you.
Thanks, Louisa. And great points that you're mentioning. Yeah, the portability is huge and also the predictability. So these again are our three types of plans in Massachusetts. I guess I would say very low risk. I mean, you're covered exactly the way you see, so there's no surprises, but you do have to pay that premium, and then the plan covers after Medicare. But you don't have prescription coverage because that's not how it works. Original Medicare doesn't cover prescriptions. In fact, Part D is what covers medications for people on Medicare. And Part D has only been around since 2006. And that's kind of a surprise to think about that prior to 2006, people on Medicare didn't have any prescription coverage, but now they do. The benefit is known as Part D, but you don't go to Social Security and sign up for Part D the way you do original Medicare. You're going to select a Part D premium. I'm sorry. You're going to select a Part D plan from a private insurance company, and that private insurance company has a contract with Medicare, which is Medicare is officially known as CMS, the Centers for Medicare and Medicaid Services. So Medicare created this drug benefit back in 2006 and decided that they would contract out this benefit to private companies to administer their drug benefit. You pay a monthly premium to an insurance company that you choose to have the Part D benefit. There are quite a few plans in the market, over 20, I believe, this year. And each plan from a different insurance company may have its own premiums. So that's a difference between plans. They could be as low as $10, $13 a month. They can be up over 100. The most average plan costs we see tend to be in the 30s and 40s. So premiums can vary from plan to plan. Also, the plans, we create our own formulary. That's a list of drugs that we cover. We have to submit it to Medicare and Medicare has to approve it, but our formularies can differ slightly. So you want to find the plan for yourself that covers what you need in the best way. So those are some differences between the plans. Co-payments, deductibles, cost sharing. We get to design our own plans and then Medicare approves us. But here's something that we must follow. We have to follow a standard outline of coverage, and those coverage levels you see here: initial coverage, coverage gap, and catastrophic coverage. These levels are set by Medicare and required, and all the plans have the same levels. Now, join when first eligible to avoid a potential penalty. So Medicare wants people to sign up for drug coverage when you are first eligible. If you have other creditable drug coverage, that's coverage at least as good as Medicare Part D, then you don't have to sign up on a Part D plan. That creditable coverage prevents any penalty. But if you go on to Medicare and you don't have creditable drug coverage from, maybe an employer, you just don't sign up on a plan, perhaps you're not taking much medication, so you don't want to. What's happening is Medicare is calculating a monthly penalty for every month that you delay. So you want to be aware of that. That penalty is 1% of the national average cost of a Part D plan, which this year that's $35. 1% is 35 cents. So it's 35 cents a month that's accumulating. So it sounds like it's low, but you can figure out the math. If you wait a few years, it's 35 cents times the months. And then that amount, someday if you sign up on Part D, that amount is totaled by Medicare. And they'll say, okay, you have a $7 penalty or you have a $10 penalty. That is deducted from your Social Security check when you sign up on a Part D plan, and it's forever. So just so people are aware of that. Here's the model of coverage that we're all following in 2022. What I'm showing you here are the coverage levels. So you're going to pay your premium to have a Part D plan. You choose your plan. You know how your drugs are covered, what tiers they're in, what the co-payments are, is there a deductible? You have to do this homework. And then we are going to cover you along these coverage levels, which starts out with initial coverage. And that is $4,430 this year. So every plan is going to give you $4,430 to spend on your medicine in 2022. When you fill prescriptions, you're going to pay the amount you're required to pay based on your drug tier. You may have a co-payment, you may have a co-insurance, you may have a deductible that can be up to $480. So you'll pay your portion at the pharmacy, and the plan that you're on is paying the remaining cost. And together, what you pay and what your plan pays, that's the total drug cost, and that is being deducted from the initial coverage every month. So let's say, quick example, I have a medication, $25 copay is what I pay. My plan pays $75. That would mean my total drug cost was $100. $100 comes out of the $4,430. Now I have $4,330 left. So every time I fill a prescription, I'm debiting down that initial coverage. So, and you get statements from your plan, so you don't have to figure it out. You'll get accounting from your Part D plan. So if people's medications at the end of the year are less than $4,430, they'll stay in that initial coverage, just paying cost sharing as they fill prescriptions. If people's medications are more than the initial coverage, maybe someone's drugs cost $7,000 a year, well, these people have run out of money. They have run out of initial coverage is what I'll say. And they've moved into the next level, which is called the coverage gap. In that coverage gap, now you're buying your medicines at discounted prices. You're paying 25% of the cost of generics or brands. That excludes any dispensing fee. Most people stop right there in the coverage gap. Every January 1, you get a new amount of initial coverage. But we all know people with very high cost drugs. And if your medications are really expensive and your personal cost sharing totals $7,050 before the year has ended, this is what would move people into catastrophic coverage for the rest of the year. And in catastrophic coverage, you're going to pay the greater of the small copays you see on the chart, or 5% co-insurance for the rest of the year. And every January 1, the whole model resets. Louisa, anything you want to add to that?
Yes. So one of the things that it's important that you do is start, if prescription coverage is one of those items that is very important to you, make sure that you do your homework before you join a plan. You definitely want to make sure that that prescription is part of the company's formulary. But as important, you want to know what is going to be your out of pocket. Is it going to have a deductible? What is the copay you will have to pay? So those are very important things that you need to know. And also, one way to find that out, there's two ways that you can find that out. One of them, you can actually go to the website, medicare.gov. You can enter your prescription and it's going to provide you with the plans that cover that prescription. But you can also call your plan you're looking into and just find out if it is a covered prescription and again, what the cost would be. So yes, it's a very important thing that you need to do up front so you're not going to be surprised when you enroll in the plan and go to the pharmacy to fulfill your prescription. With that, back to you, Heather.
Excellent points. And people can also see a Shine counselor. And I know that the Andover Senior Center, the Robb Center, has a Shine counselor. This is someone who can help you with this Part D selection as well. So let me move on now and talk about another way of doing things. Some people really like the Medicare, the supplement, the Part D. They get to customize things exactly to how they want it. The supplements are very predictable. They don't have co-payments. They can see any Medicare provider. Other people might say, that's not the way I want to go. Too many cards in my wallet, too many premiums, too expensive. Isn't there another way? And these people might sign up for a Medicare Advantage plan. Medicare Advantage plans are offered by private insurance companies that are contracted with Medicare. We create networks of providers. So now if you're on an Advantage plan, you usually are you want to be aware of who the providers are that you can see in the network. The plan will have a network. Advantage plans are going to take over and give you all of your Medicare benefits, but they add in extra benefits. Usually they include the drug coverage. So we just went through Part D. The Part D benefit here in the Advantage plan, it would still have those 3 coverage levels that we looked at, but now you're not paying another premium. It's all included in your Medicare Advantage plan. And members, you have to continue to pay your Medicare premiums, your Part B, you pay that to the federal government. You may pay a premium for your Advantage plan. And why do I say you may? And that is because there are 0 premium plans in the market. There are quite a few this year, Medicare Advantage, HMOs, or PPOs, where it's a $0 premium. You don't pay you don't get a monthly bill, you just enroll. So some people like that when they're trying to save money on their monthly budget. What you definitely have to consider, though, is Advantage plans require that you pay cost sharing. Cost sharing is something that you pay as you use the plan, as you have medical services. And cost sharing might be in the form of co-payments, co-insurance, things like that. You have to follow plan rules. An example is you need to live in the plan service area in order to be a member. If you leave the service area, you generally have to disenroll. So that's different from supplements where Louisa told you those were portable. These are not portable. So another slide on Medicare Advantage. These plans will always cover you for your original Medicare Part A and Part B benefits. Then, so people, get all their Medicare benefits in their Advantage plan. They're showing that one insurance card where they go for care. Now they're also getting additional benefits that are beyond what original Medicare covers. And these tend to be preventive. So a routine hearing exam, a routine vision exam, that's where you read that eye chart to see if you need a stronger prescription. Preventive dental, you'll see plans coming with 2 or 3 cleanings and oral exams a year built into your medical plan. You might see some of the extras being money towards fitness, money towards weight loss programs, money towards glasses, hearing aids. What's really big this year are over-the-counter benefits. So plans are giving you a sum of money in a year to spend on non-prescription items like cough syrup and vitamins and antacids and Band-Aids and things like that. So Advantage plans can bring your monthly premium down, and they can give you extras, some bells and whistles, I call them. But what you need to be always aware of is the out-of-pocket cost sharing. So you are going to have to pay towards your services. And that can add up to a total amount called the out-of-pocket maximum. So you want to know that number. So in our market, we primarily have HMO and PPO plans. HMO plans are managed care plans. You choose a PCP, you get referrals, you stay in the network. PPO plans, preferred provider organization plans, these plans generally have in and out of network benefits. So they're a little more flexible. You can see network providers, you can go out of network and see any Medicare provider. And you are, paying towards your services. This can add up, as I said, to an out-of-pocket max. Typical amounts are $3,400, $4,900, $5,100. They're set amounts by Medicare. So you want to be aware of that out-of-pocket maximum figure, not just the premium cost, because that out-of-pocket max that's your exposure to cost sharing. That's how much you could pay if you had lots of medical services. Anything to add there, Louisa, about Medicare Advantage?
Sure. Well, actually, one of the best things that I like to ask, it's at the bottom of this screen, and that is when you're getting closer to become Medicare eligible, you'll be getting a copy of the Medicare Annual Handbook. Really great reference. It has a lot of good information. So it's very helpful as you're trying to decide what Medicare Advantage plan may make the most sense. If you don't get a copy, you can actually stop at a Social Security and pick up your own copy. But we find those booklets to be very, very informative. And they're about 100 pages, and it would have all the plans available in your area, including a highlight of benefits and costs. So always a good resource for you to look into if you are getting to the point that that is an book that you like to get. And with that, back to you, Heather.
Thank you. While you were talking, I was looking for it. I have one, but I'm not sure if can people see it over Zoom? I'm not sure if it's coming through as an image on the screen. This is what the Medicare and You handbook looks like.
It's coming through.
Oh, it is. Oh, okay.
You can barely see it, but I also just wanted to mention, we do have a few copies here at the Rob Center. So if you stop by the front desk and ask for one, we do have some. And
that's great.
In Spanish as well.
Excellent. Excelente. Thank you, Kelly. Okay. So excellent points, Louisa. So we've covered now Medicare, federal coverage, supplements, you buy them on the state level. Part D, that's paying for your prescriptions. Those are plans from private companies that are contracted with Medicare, so they're federally regulated. Medicare Advantage, same, federally regulated. And so let's talk about enrollment periods. When can you sign up on these plans? When can you change these plans? Well, remember we talked about the initial election period, that first time you're going on to Medicare, 3 months before to 3 months after, you can sign up for any of these plans. Then every fall, there's an annual election period, October 15th to December 7th, for a January 1 effective date. So every fall, you can change your plan. So we don't want people to think, some people get so stressed out when they're going on to Medicare and they think, oh, what do I do? You make your best decision given your health circumstances and finances that year. And if things change in the fall, every year you can reevaluate. The plans announce new changes, and so you can evaluate as well. There is another time period for people on Medicare Advantage called Medicare Advantage enrollment period, January 1 to March 31, during those dates, you can switch to a different Advantage plan or disenroll from that Advantage plan and go back onto original Medicare. And Medicare also always recognizes special circumstances. Some are listed there. Early on in the presentation, I said that Part B premium was $170.10 per person per month for most people in 2022. But I said if you had a high income bracket, you might pay more. So let's take a look at who might pay more. When you go on to Medicare, the first time, they look at your taxes and they do a 2-year look back on tax returns. And they look at 1-person households, and there's a range of income, or 2-person households, married couples, and there's another level of income. And if they determine that you're in a high income bracket, then they're going to ask you to pay what's called an Irma charge. That stands for income related Medicare adjusted amount. So the Irma charge will increase the cost of Part B, and there's an extra charge tacked on to Part D, your drug coverage. So let me read the second line down on the chart. This is where people first start being asked to pay an Irma charge. Let's say you go on to Medicare as an individual with a modified adjusted gross income above $91,000 and $1 up to $114,000. Now, instead of paying the $170.10 per person per month for Part B, you're going to pay $238.20 per person per month. If you have Part D benefits, they're going to add $12.40 onto the cost of Part D. That'll come out of your Social Security check. And then it goes up from there for people in very high income brackets. This doesn't have to be forever. If your income changes and goes back into that first line, the first range, you can have your premiums readjusted. You go back to Social Security. Here's a helpful resource slide for everyone, a way to contact Medicare, Social Security, the State Health Insurance Assistance Programs, SHIP. This is an agency you can go to for information about supplements, national supplements. In our state of Massachusetts, we have a similar program known as SHINE. I mentioned that already. SHINE counselors are excellent. You have one at the Andover Council on Aging, and you can also call a toll-free number to speak to a SHINE counselor for any type of assistance related to Medicare. Mass Medline is a pharmacy outreach program. Questions about prescriptions, that's free. Prescription Advantage is for Mass residents. If you're concerned about drug costs and going into the coverage gap, you can sign up for Prescription Advantage. It will offset your costs. I would encourage everyone to do that. It's not a low-income program. And Blue Cross Blue Shield of Massachusetts, this is where Louisa and I work. We're on the senior outreach team. We sell every kind of Medicare plan that we've spoken of today. And we have in-person seminars now. We're after COVID, we weren't out in the field, but now we're going back out again and doing presentations. I think the closest location to Andover is the Burlington Marriott or the Peabody Marriott. Sometimes we're at Spinelli's in Linfield on Route 1. But we also do, if you don't want to go out, we do webinars every single day, just like this over Zoom. You can find them on our website and we present our plans. If you have a quick question, there's our call center. So that's the end of the Medicare section. I don't see any questions in the chat. This next section is really short. So I'm just going to finish this up and then I'll go back to Louisa for final comments and final questions from the group. So what if you decide you want to retire before you're 65? Some people are lucky and they can do that. Sometimes they have a younger spouse. They might be 65, but they're covering their spouse who's 60. So oftentimes we get this question, what kind of coverage can we have after we leave an employer plan before we become Medicare eligible? So really your options for continuing coverage, you can put into these three categories. If you retire younger than 65, but you have a spouse or partner who is working and carrying insurance, you can usually move over to their plan. Your employer, another option is your employer will offer you usually COBRA when you leave. You can continue with COBRA, or you can buy a direct pay coverage from an insurance company or your state's exchange. Most people are considering the monthly cost of the three options, but also the plan design, providers who are the doctors you can see. These are considerations. So let's say you stop working, but you have a spouse or partner who is working. You can look at going onto their plan. Make sure you check with their employer that they recognize this qualifying event that you've had, letting go of employer coverage. That will usually make it possible for you to get onto your spouse's plan as a dependent. And you want to know how much that's going to cost. COBRA is something you'll be offered from your employer. And a lot of people who, let's say they just have a few months to go before they're going on to Medicare, a lot of people just take COBRA. It's easy. It's the plan you're on. It's a matter of filling out some forms, some paperwork, and then you stay in the plan. But what you don't know is how much the premium is, because your employer has been paying the cost of that plan for you. And now when you're on COBRA, you're paying for that. So you want to get that information ahead of time, see if that's okay. Generally, you can stay on to COBRA as a former employee for up to 18 months. Sometimes dependents can for longer. It depends on the qualifying event. Direct pay is also an option. We've had direct pay plans here in Massachusetts since 2007. You can go right to an insurance company and say you want to buy a direct pay plan. Most people go to their state's exchange. Ours is the Massachusetts Health Connector. So you can buy a direct pay plan for an individual, for two people, for full family. And the under 65 market is not individual like with Medicare. There's a toll-free number there for you, how to reach the connector in a website. They can give you a quote for a variety of insurance plans, not just one insurance company. You can go to the connector and get a quote for, several types of plans. There are no cost and subsidized plans for those who qualify, and standard rate connector plans. When you become eligible for Medicare, don't stay on the connector plan. Go onto Medicare. And I believe they tell you that you have to, but I just want to let people know that, because the connector plan will not prevent a Part B late enrollment penalty, because this is not an employer plan, it's a direct pay plan. So I'm going to check back in final time with Louisa and see if she wants to add anything, and then we'll see if the audience has any final questions.
Thank you, Heather. Just a quick little recap. So we started with original Medicare, you having to pay your Part B premium of $170.10 for most people. From there on, you have decisions to make. Do you want to go with a supplement plan that has predictability, although a little bit more expensive? But then you would need to add a prescription plan to make sure you have prescription coverage. That's one way. Or you can go and consider a Medicare Advantage plan. They start from zero premium and then up to $200+ for a monthly premium. And with that, back to you, Heather.
Thank you, Louisa. Most Advantage plans are under $100, but thanks for giving that range. Does anybody in the audience have final questions before we conclude? You can put them in the chat or unmute yourself.
I have no plans to retire. I'm currently.
Can't hear you very well. I'm sorry.
Well, if you start, I'll ask. So you have no plans to retire, right? My husband has a small business with a plan. Her and her husband have a small business with a plan. But because I'm turning 65, I have to enroll in Medicare and leave that plan. So she's confirming that because she's turning 65, she has to leave the current plan she's on and go on Medicare.
Under 20 employees?
Yes. Yes.
That's my understanding. You can contact Social Security to ask that question, and I would also call your insurer, whoever that is, and see what they're saying to you. I believe Medicare has to be primary if the employer is under 20 employees.
Okay, thank you. And just as a follow-up, if I were to stay with that and then.
So as a follow-up, if she were to do that and then
Enroll in Medicare.
enroll in Medicare,
Then I would be faced with penalty for late enrollment.
then
You'd
she
be
would be,
preventing a Part B penalty, but but if your employer coverage has Part D, has prescription coverage, I don't think you need to sign up on a Part D plan. What you want to ask your insurance company, your group plan from, whoever you're getting it from, is this creditable coverage? If they say it's creditable, you don't need to buy Part D for drugs. You do need B of Medicare, but you don't need Part D until that employer plan ends.
Okay, thank you.
thank you.
Anyone else?
I have a question, if I could ask. Can you hear me okay?
Yes, I can hear you.
Okay, so I think I just need confirmation, or maybe what to do for next steps. I'm trying to plan ahead. So I am not eligible for Medicare. I just turned 60. And I am currently employed and have private healthcare insurance through my employer with over 20 employees. My husband is collecting Social Security disability and is eligible for Medicare. In fact, I have his Medicare card. But we declined Part B because he's covered under my employee healthcare
Exactly.
plan.
I'm glad. Yeah, you don't need Part B for him as long as you're covering him.
Right. And does that seem like what I should be doing going forward for the next few years?
Yes,
or-
yes, you
okay.
can cover him. I mean, if you keep working, you can cover him indefinitely.
Yeah,
And he doesn't need Part B while he's a dependent on your active employer plan.
okay.
Yep.
Financially, do you know, I mean, I know you don't know what my plan costs and I couldn't tell you off the top of my head. I know it's not like super inexpensive, but I'm just trying to weigh the pros and cons financially, what that would
Yeah.
look like.
That's something that you can do. That's a good
Yeah.
exercise you could go through with a Shine counselor, is you can
Okay.
bring in your plan benefits and
Yep.
premium and talk
Okay.
to a Shine counselor, because your husband actually has a choice. He can stay on your group plan, or he can go on to Medicare. But usually when we meet people, they keep the group plan as long as they can. You
Okay.
want to, ask your employer, if you took him off the group plan, what would the new premium be? Or
Yep.
usually at open enrollment, they give you those rates, right? They give you individual, they give you
Yep.
2-person, so you can figure it out.
Right.
But what's the biggest difference is the drug coverage. So if your husband's taking prescriptions, your employer plan may be just covering whatever he takes and you just pay cost sharing. Whereas on Part D, what you saw is that you have a limit in your coverage.
Right.
It's $4,430. And
Yep.
this year, I don't know what it is in 2023. And so you could go to the pharmacy if he's taking prescriptions and say, how much do his drugs cost? And you
Oh.
could try and get that ballpark and,
Okay.
find out if he's, way over 4,430 or
Okay.
under, or because it wouldn't be good to let go of the employer plan for a little bit of savings if all of a
Right.
sudden he's going to pay much more for his prescriptions.
Exactly.
You know what I mean?
Yes. Yes, exactly. That's perfect.
But a Shine
Okay,
counselor
okay.
could do that with you too.
Okay, fabulous. All right, thank you.
Thank you so
Appreciate that.
much.
Yeah,
Well, I hope everybody has a good afternoon. I hope this was helpful for you. And Kelly, thank you so much for scheduling this.
Thank you, Heather and Louisa, for explaining everything to us. It was very helpful. And I will have the recording, like I mentioned. And if you send me those slides, I can send them off to anyone who is registered with us.
Will do.
Awesome. Thank you so much.
Take care.
Thank you. Thank you.
Thank you.